The Trump administration announced the amount of funding each state will get for the first year of the Rural Health Transformation Program. The program will award $50 billion over 5 fiscal years. Half the money will be split evenly among states. The other half will be awarded through a point system based on a set of criteria. Of that second half of discretionary funds, about 20% is based on a state's commitment to specific policy actions. Maine will be receiving $190 million for rural hospitals and providers through the program. The provision to grant states extra points if they agree to implement Trump administration policies has drawn criticism. States will be rescored each year, and funds may be clawed back.